is Dr. Melanie Palm from Artist Skin MD in Solana Beach, California, outside of San Diego, and today we're going to be talking about Sculptra for the chest. And so Sculptra, which is polyalactic acid, is basically a milk sugar, and we use it as a series of treatments, typically in the face to rebuild volume. And I love it because it gives gradual volume repletion over about a 3 to 6 month period, and it's FDA approved for 25 months of duration, so it lasts at least 2 years. And if you look in the medical literature, there's often longer duration than that, so sometimes you can squeeze a little bit longer. We sometimes use Sculptra off the face, and one of my favorite places to put it is in the décolletage area. So over time, a combination of the thinning of the tissues and also UV or sun damage causes these vertical rhytids or vertical wrinkles that we can develop in the décolletage area. And by putting Sculptra there, usually I do a series of 3 sessions, and then every once in a while we do a maintenance treatment. At very dilute volumes, we can restore that V-shaped area of the chest, give a little bit of soft tissue volume back, and help plump the wrinkles so that they soften over time. So we're actually going to demonstrate that technique right now. It's really simple. The patient has had some topical numbing on for about a half an hour, and all we're going to do is in this V-shaped area is we're going to do some small injection points and use a fanning technique to give her some volume in that area. So I'm going to start around here, and we're going to do a little pinch on 3. 1, 2, 3. And we're just going to kind of fill that area. Go through that little numb zone. I'm going to fill a little bit more in the center there. And what happens is over about a 6-month period, the little Sculptra particles begin to cause your own body to stimulate collagen growth in those areas. And so I really like Sculptra because it promotes neocollagenesis or new collagen formation. So it's your own body that's doing the volumizing, and therefore it looks really natural. Here, 1, 2, 3. And in this particular patient, just sort of that central area, she was really bothered by. So we're going to make sure that we give some nice improvement there. And when I'm injecting, I'm really injecting at sort of the dermal subcute border, so sort of in that fat layer. And you just want to see a nice plumping and tinting effect. There's also some numbing in the Sculptra itself, so this should be pretty comfortable for the patient. They really do well. Almost halfway done. You can see this is a pretty simple, easy procedure. It's done in the office. Depending on the patient, it's about a 10 to 15 minute procedure. Move over here a little bit. Going to the numb area, and now we're filling this inferior area and just fanning again. A little poke here. Perfect. And as opposed to, the dilute volumes that we use on the face, we even super dilute it on the chest, just to, number one, be able to cover a little bit more surface area, but also prevent collagen bump formation, which we obviously want to avoid on the chest area, which is uncommon and I've actually never seen. In the home stretch. Last little bit, we're going to focus again down here where the little trouble spot is. And after we're done, we massage the patients firmly in this chest area just to distribute the product.
And then I have the patients at home do something called the 5-5-5 rule, which means 5 times a day for about 5 minutes for the next 5 days. They're going to do little circles of firm pressure in that area. And I tell them it's not so much that they're distributing the product as they're really getting the circulation going in that area so that their body recognizes that, I'm going to do a little massage now, that Sculptra's there, and for the body to sort of send early signals saying, hey, we need to start forming some collagen there because the Sculptra's been placed there. Usually this is done as a series. I usually originally talk to patients about 3 treatments. Does a great job, I think, for the décolletage area with the maintenance every once a year, maybe once every 2 years to kind of keep things up. And it really takes about 3 to 6 months to notice the difference. And usually the frequency of actually doing the Sculptra treatments is about monthly. So that's the end. So thank you for tuning in for Sculptra of the Chest. If you have any questions, give us a look at www.artofskinmd.com, or you can give us a call at 858-792-SKIN.